chronic hospital staffing shortages across the country. Dr. Raghu Venugopal joins us now. He's an emergency physician for 3 hospitals within the Greater Toronto area. Doctor, first of all, thank you so much for joining us today.
Good morning, Lois.
Good morning. So, Dr. Venugopal, we know Ontario's emergency rooms are among those facing huge staffing shortages. What are you seeing particularly at your hospitals?
What I observe where I work is that people with major dislocations will wait for hours to have that joint put back in because we lack nurses and beds. Patients with important fractures will wait hours as well to have that bone reset because we lack nurses and beds. Patients who need admission to hospital will wait 2 to 3 days on a hospital gurney because there's no bed to admit them to. And then further times, I even see my own trauma patients who may be up to 4 days on a hospital gurney because there's no bed to admit them to. The theme is the same. We are lacking the nursing and bed capacity. We observe hospital ERs have up to 3/4 of their beds admitted to other services and therefore cannot use those beds for new incoming patients. And how that plays out is very difficult circumstances for nurses and doctors and patients.
I can imagine, because you're talking about a situation where it's not a normal situation. Staff seem to have to come up with solutions on the fly. Talk to us a bit more about those decisions you've had to make, some examples where you haven't had to make those decisions before.
The decisions are pragmatic. Patients have to be seen. And so you sometimes have to see them standing up in the hallway, standing up at the nursing station counter, in a chair in the hallway. What happens is that your admitted patient with a bowel perforation, she may wait for 12 hours in a hard-backed hallway chair before going to the operating room for urgent surgery. And so whether you're a doctor or a nurse, really it's making the best out of the worst. And what we need to start with is our leaders, the Premier of Ontario and the Minister, to start being truthful to the Ontario people.
Talk to us a little bit more about that and your thoughts there, because the Ontario government says that 90% of patients are getting the health care that they need. What happens to the other 10%?
So that quote is either misleading or a blatant lie by the Premier and by Minister Jones, the Minister of Health. They have misrepresented their government's own main 3 statistics that are tracked to the province of Ontario. They have chosen the most flattering statistic, which is the amount of time high acuity ER patients spend in the ER. And you can imagine how that plays out. Someone with acute anaphylaxis or acute asthma will be treated very quickly. The 2 other statistics that the Premier and Minister glossed over, particularly the statistic of 24% of patients needing admission to hospital are meeting provincial benchmarks. That statistic alone explains entirely why ERs in this country and in this province are collapsed. It's because the beds in the ER don't belong to the ER, but they belong to the hospital, and they're being filled by patients who rightfully are admitted to hospital. But by misleading the Ontario people, by not reporting on the most important statistic that explains why ERs are collapsing in this province, the Minister and the Premier do a great disservice to the people of Ontario. Because our public servants, like the Premier and Minister, have to start by telling the truth.
And just finally here, Doctor, I want to ask you about your thoughts on the Ontario government asking the regulatory colleges for doctors and nurses to come up with a plan to expedite the accreditation of internationally trained healthcare professionals. How helpful will this be, and how quickly do you think it can be done?
You know, I applaud the Minister and the Premier for speaking with the public this week. It was long overdue, so I applaud them. I also applaud this move. It's been a long time coming. We have people who are living in Canada, whose families are in Canada, who are not practicing nursing and medicine. And if we can coach them, mentor them, train them, accredit them, ensure they are ready to serve the public, they should be doing their profession. And so I applaud the Minister and Premier on these announcements. I think they're one of many solutions we need. But if I can put, Lois, a peg on it, to stop the hemorrhage of nurses, we need to scrap Bill 124. And the Premier and the Minister know that very well.
Okay, we do have to leave it there. We thank you so much for your time, Dr. Raghu Venugopal, emergency physician for 3 hospitals within the GTA. Thank you so much.
Thank you.